Genitourinary syndrome of menopause is defined as a collection of symptoms and signs associated with a decrease in estrogen involving changes in the labia majora and labia minora, clitoris, vagina, and bladder. Some of the symptoms are dryness, burning, itching, painful sex, and postcoital bleeding. These issues face a great percentage of women, and this number continues to grow. This not only applies to women who are peri- and postmenopausal, but young women on medication, women who have hysterectomies, or simply dealing with stress of life. Luma Skincare is proud to introduce the CO2LiftV, a take-home vaginal treatment, another product in the CO2Lift Carboxy Gel line.
Is providing a real solution to a problem that women have of vaginal dryness, of all the things associated with aging of that area. And I feel that to be able to provide a solution that a woman can do in the privacy of her home that's effective, it's something that I'm very passionate about.
Over the past 85 years, carboxytherapy has effectively been used to treat patients with different pathologies.
It increases the local blood flow of the vulvovaginal tissues. And when you increase the blood flow of the tissues, you can then increase the ability of the fibroblast to create new collagen and perhaps new elastin. You increase the microcirculation of the tissues so that the nerves are fed with the oxygen and the sensitivity can improve. There have been studies with histopathology and looking at the actual tissues that are treated, and you can see the increase in the diameter of the blood vessels, the microcirculation. It's measurable. It's a measurable increase in vascular blood flow.
Statistics show there's a growing demand in solutions for vaginal rejuvenation.
So the CO2LiftV is of interest to me primarily in practice as we've seen trends in plastic surgery over the last handful of years. We're seeing that more and more women are undergoing rejuvenation of the genital area, and having a novel, non-invasive way to deliver carboxytherapy so that the patient can take it home and have some very significant benefits.
CO2LiftV is easy to apply. The gel is mixed and then extracted with the syringe and inserted into the first third of the vagina and applied around the vulva. It keeps on for 45 minutes, then douched out the vagina with water using the syringe provided. The gel will fall out. Then wipe off the gel from the vulva. Women often see results in as little as 3 applications.
I started using the CO2LiftV. I finished the first 15 and I have noticed the change from the 3rd or the 4th. It has been amazing. I feel a lot more lubricated, a lot more, and I don't feel any pain. My husband has felt the difference. We are very, very happy.
Several small studies have been done on the safety and efficacy of the product. These tests included using the FSFI questionnaire and the Gloria Bachman VHI questionnaire and doing biopsies. The results are very promising, concluding that the CO2LiftV would be an effective alternative for patients looking for a solution that involves no hormones, no surgical recovery, nor downtime. Women all over are benefiting from CO2LiftV.
Visually, my results is that there's a firmness there. It is not as lax, it's tighter. I feel like it looks better in that case, and then the dryness has definitely decreased. I also have not noticed any incontinence, urinary incontinence. It helped with that initially, which was not something expected. And the biggest thing that I noticed was the dryness was alleviated prior to intercourse, and then during and after I did not have the pain.
Today, more and more women want to control their own sexual experience and are looking for a solution for this inevitable problem.
This product is not just working on the appearance and the overall health of the vagina, but it's also working on the mind. That is the part of the product that I absolutely love.
Interestingly enough, even though I got it to help with painful sex, the cosmetic results are amazing. It tightens it's soft and smooth, and my husband even noticed, and he thinks it looks fantastic. now I'm not afraid of it. So, when you know you're about to have pain, you naturally tense up even more. And so that's gone. And the apprehension towards sex is gone. And it's what it should be. It's fun.
The CO2LiftV has been used by professionals after episiotomies and labiaplasty and is appealing to providers because it is effective and simple.
There are so many women that do not respond to some of the treatments out there. So we have extreme. We have women that cannot use estrogen therapy. They have many different risk factors. And so there's really has been no other option besides major surgery or doing a procedure with a lot of women cannot afford.
CO2LiftV can either be used as a standalone or as a post-care for radiofrequency or laser.
With the CO2V lift, it seems to extend the time between Thermiva treatments, and with the CO2V lift with Thermiva, the patient definitely maintains the tissue moisture, the comfort, the blood flow of her tissues, and in fact, the improved sensitivity.
I feel very blessed to be a part of this project just simply because of the fact that I know it works. And so I can say that I'm not just the president, but I'm a client.
It is a must-have for any provider looking to be a part of the solution to this growing need.